A warm greetings. Everyone in the globe knows that health should be the priority of our life. But for every 30 seconds, a person dies with hepatitis related illness. Hepatitis, incurable inflammation of liver. And this year, with the theme of Hepatitis Can't Wait. Here, we, the first year students of SRM Dental College, Ramapuram, presenting you an awareness video on this World Hepatitis Day, conveying the urgency of efforts needed to eliminate hepatitis as a public health threat by 2030.
Out of 41,033 donors, 566 of them are likely to be affected by hepatitis B, whereas 961 of them are likely to be affected by hepatitis C, which accounts for about 3.6% if I'm not wrong. I know, that doesn't make sense. What I'm trying to say here is that out of 100 people, 4 people are most likely to be affected by hepatitis belong to either blood group O positive or B positive. Now what is hepatitis? Hepatitis is the inflammation of the liver. Inflammation is the swelling of the liver which occurs when the body tissues are injured or infected. This can affect how your liver functions. Hepatitic virus are the most common cause of the disease. Of course, it includes other causes such as infections, certain toxic substances like alcohol and whatnot. There are 5 main types of hepatitic virus. They are type A, B, C, D, E, and of course it does not include F and G.
Hepatitis A is a viral liver disease which can cause mild to severe illness. It is caused through the hepatitis A virus and it is spread through the consumption of contaminated food and water resources. The risk of hepatitis A is dependent upon the lack of poor sanitization and lack of safe water.
Hepatitis B is a serious liver infection caused by hepatitis B virus. This disease is most commonly spread by exposure of body fluids like blood, semen, etc. Hepatitis B is 50 to 100 times more infectious than HIV. Hepatitis B is mostly prevented by vaccination.
Hepatitis C is an infectious disease caused by the hepatitis C virus. It spreads via blood transfusion or from a mother to child during labor. It mainly affects the liver and causes liver cirrhosis or liver cancer. In the earlier stages, the symptoms are almost unnoticeable. In the later stages, symptoms such as dark urine and liver disorders appear.
Hepatitis D, also known as hepatitis delta, is an infection that causes the liver to become inflamed. It only occurs among people who are infected with the hepatitis B virus. The symptoms are abdominal pain, nausea, fatigue, and jaundice.
Hepatitis E is the inflammation of the liver caused by infection with hepatitis E virus. It is a type of viral infection. It has mainly a fecal oral transmission route that is similar to hepatitis A. The symptoms may even include nausea and jaundice, and the complications may even lead to liver failure. There is no drug that has established the safety and effectiveness of hepatitis E, but studies suggest that ribavirin can be considered effective.
Symptoms. Some people with hepatitis do not have the symptoms and do not know that they are infected. Few symptoms like fever, fatigue, loss of appetite, nausea or vomiting, abdominal pain, dark urine, joint pain and jaundice. If it is an acute infection, the symptoms can start anywhere between 2 weeks to 6 months after it is infected. If it is a chronic infection, we may not have the symptoms until many years later.
The diagnosing process of hepatitis is undertaken by 4 steps. First is a physical exam. It is to look for signs and symptoms of a viral hepatitis and is done by pressing against the abdomen to assess the liver. An eye skin examination is also done. Second is a blood test. It is to look for signs that a viral infection is present and to evaluate the liver function. Third is an imaging test. If hepatitis is confirmed, 1 or more imaging tests are done to assess the liver damage. Ultrasound, transient elastography, MRI and CT scans are some of the tests recommended. Fourth is a liver biopsy. A tiny sample of the liver tissue is taken and tested in labs to know in detail about the condition.
Treatment for hepatitis is commonly dependent on the types that a person infected with. In general, viral hepatitis is treated with antiviral medication. Hepatitis A requires rest, adequate hydration, HEPA protectors, and also vitamin therapy. Hepatitis B, it clears upon its own. In some chronic infection, it requires medication and possibly liver transplant. Hepatitis C, it requires antiviral medication. Hepatitis D, it mostly treated with alpha interferon or antiviral medication and along with adequate fluid intake. Hepatitis E, it treated with the drug of antihistamine or antispasmodics and glucocorticoids.
According to new WHO estimates, globally 354 million people are living with chronic hepatitis. Over 90% of the people with C type can be completely cured of the virus, but the needy aren't largely treated due to the lack of access and awareness of the treatment. Timely testing, treatment, and prevention of this disease is important even in the midst of a global pandemic. So let's all take a prideful step towards a hepatitis-free future. Thank you.